You've probably heard of gluten. It's the protein that gives dough its elastic texture and baked goods their chewy quality. In fact, gluten-free diets have become a bona fide weight loss fad these days, as evidenced by all the gluten-free products lining our grocery store aisles. But for more than 3 million people in this country living with the autoimmune disorder, celiac disease, gluten-free is a way of life. When they eat gluten, their body launches an immune response which attacks the small intestine. These attacks lead to damage to the lining of the small intestine and prevent the ability to absorb nutrients. The specialists at Advanced Gastroenterology and Surgery Associates explain how they treat patients with celiac disease.
Celiac disease, we see more and more now because more people are aware of it. So many articles are written about gluten-free diet and things like that. Even if a patient has no celiac disease, they still stay on it because they do feel better when they stay on the gluten-free diet. So a lot of times patients come in, they will complaining of diarrhea, weight loss. They can present with skin rash, anemia, liver enzymes might be elevated, so you have to be vigilant and see if this could be one of the possibilities, and you have to do the workup for celiac disease. And usually the first thing that I do with these patients is getting a blood test to see if they have the antibodies that diagnose for celiac disease. If that comes back positive, then you can confirm it with doing the EGD to do the biopsy of the small intestines. And if that is positive, that's likely to be the gold standard to diagnose celiac disease. There are lots of overlaps in their presentation, so you have to be vigilant and also spend a lot of time to get all the details of their problem and try to eliminate as best as you can, because if they have celiac disease, they're going to have long-term consequences. So you have to make sure you have the proper and the accurate diagnosis for the patient so you can treat appropriately. It can be troublesome for patients because it can lose a lot of weight loss, the quality of life is not there, and it can put a person at risk for vitamin deficiency. They could even lead to cancer because some of these patients are at risk for lymphoma if they're not taking care of the problem. The treatment for it, even though it seems so simple just to tell patients to be on gluten-free diet, but it is so difficult because the gluten is almost everywhere. You can see it in food items, you can see it even on makeup, and you have to ask the patient to read the label. A lot of time I would recommend a patient to go to a dietitian who can just go down the list and telling them which food items that they can or should eliminate from the diet. There are a small population of patients, even though they are not celiac disease, but they are non-celiac gluten sensitivity. So they do have all the symptoms of a celiac patient, but the antibodies, the blood work, and the procedure did not confirm that they have celiac disease. But once they stay on the gluten-free diet, they do have a positive response from it. So we diagnose that as non-celiac gluten sensitivity. So we've been seeing some of those patients in the office as well.
September 13th has been dubbed National Celiac Disease Awareness Day in honor of the doctor who identified the link between celiac disease and our diet. Dr. Samuel G., a leader in celiac disease research, was born in 1839 and gave us the first full clinical picture of this disease. For more information on celiac disease or on the services provided at Advanced Gastroenterology and Surgery Associates, please click the Treating Celiac story link icon on our homepage, yourhometownhealth.com.